Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, the results of this particular study do not come as any big surprise. We have seen over the years that it is very clear who you should see first for most musculoskeletal problems. We can say non-surgical, but most cases are not surgical anyway. And even if they turn out to be surgical, you're still better off seeing the right type of provider first. I clearly have a bias, but the research is very consistent in finding out who is the best person, or pointing out who is the best person to see for pretty much any of your musculoskeletal complaints. But before I go on, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. Now, this study followed Medicare beneficiaries for 4 years, and they looked at 3 different scenarios for new onset neck pain. They called it spinal manipulation group, but reality is the chiropractors do some like 95-98% of spinal manipulation in this country, so let's just call it the chiropractic group. The other group was, or the other potential pathway was a primary care doctor without a prescription for analgesics, so whether that would be anti-inflammatories or like we're very careful with opioids these days, so analgesics are usually like anti-inflammatories are usually on the list, or a very low level painkiller, maybe like a muscle relaxer like cyclobenzaprine or cyclobenzaprine or methylcarbamol, but so no prescription within 7 days, or a primary care doctor who did give a prescription right off the bat. They're just whipping out that prescription pad and writing a prescription. So what did they find as far as the outcomes for care escalation? So in other words, how likely was seeing each of these type of provider scenarios to progress to something more complicated? If somebody saw a chiropractor first, they were 64% less likely for that to turn into anything major. If they saw, and that was compared to primary care doctors without the script, if they saw a primary care doctor and got a script, they were 8% more likely than to escalate than if they didn't get a script but saw the same primary care doctor. So clearly, drugs are a problem, and they have a tendency to make things worse. I say this all the time. We have no real concept as a society of how much even over-the-counter analgesics affect our progression to chronicity. We use them way too often. We don't even consider the side effects. Forget the GI, liver, and kidney, but also the cardiovascular effects and the effects on the joints and soft tissue healing. Like they're significant. But overall, it's very clear that seeing a chiropractor first was the best outcome by far in these Medicare beneficiaries. I clearly have a bias even when it comes to seeing somebody to do physical medicine, whether it's chiropractor or PT that does adjusting. But adjusting is a powerful tool, but when you add it with soft tissue approaches, the outcomes, I'm sure, would be even more stellar in this particular study. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.